let's reiterate what Rudy has just said.
Yeah.
So look, in hypogonadal men, testosterone therapy does not increase the risk of developing prostate cancer, even in high-risk individuals. In fact, it has a protective role against cancer. Studies show that higher levels of testosterone suppress prostate cancer growth. That's number one. Testosterone therapy does not increase the risk of progression in men on active surveillance. In fact, low testosterone is a predictor of who will progress on active surveillance. Testosterone therapy does not increase the risk of progression does not increase the risk of progression of men that have been treated for prostate cancer. It doesn't increase the risk of biochemical recurrence if you've had a radical prostatectomy or radiation therapy. In fact, there are decreased recurrence rates in men on testosterone therapy. Low testosterone is associated with an increase of developing prostate cancer and higher grades of cancer. Let me repeat that. Low testosterone is a risk factor for developing prostate cancer and higher grades of cancer. It's associated with more advanced stage of cancer at surgery and an increased rate of recurrence after surgery, as well as decreased survival. So it is not normal testosterone levels or high testosterone levels. It is, in fact, what we're seeing now in multiple studies is that men with low testosterone levels, it is a negative predictive value across the board.